difficulties. So still getting everything set up here, but while you're sitting there, let me know where you're tuning in from. We're tuning in from California over here. Oh, Maryland. Hello. Okay. Washington, Texas. Oh, I love the Oregon. I'm gonna be up in Portland in a few weeks. Hello, Portland. Wisconsin. I'm from the Midwest, so hello, Wisconsin. We got some more Sacramento, California, Las Vegas. Perfect, wonderful. It's so great to see where you guys are tuning in from. Wonderful. While you guys are logging on, I want to do a little housekeeping. So during today's webinar, we're actually going to be doing pre-op and post-op all together. We're going to do a little snippet on vitamins as well. And as I'm going through the webinar, I love to hear questions from you guys. So when we have questions, make sure you're putting questions in the Q&A box specifically, because that's what I'll be looking at while I'm doing my webinar. And I won't be looking at the chat box until later on throughout the webinar. So to make sure I address your questions, put in the Q&A box, leave the chat for more commentary. Sometimes I'll kind of shift it back out to you guys to ask you guys some questions and just things that the whole audience could benefit from. Put that in the chat box so that everybody can see. Wonderful. And I will be during the webinar pausing at a few different places to take questions that pertain to that section. And at the end, I'll do a wrap up and try to answer as many questions as I can get in today. All right. Wonderful. We got some more people logging in from Texas. Wonderful. All right, so I'm going to get started here. I apologize that we're running a little late, but we're going to start it right now so we can stay on schedule. I want to spend the first half an hour focusing on pre-op diet. There we go. So about me, I was with Mexico Bariatric Center a few years back, a little over a year ago, and I am back briefly just to give some webinars for you guys. So typically you're going to be working with a different nutritionist here, and she'll be answering your questions. I am just here temporarily for the webinar purposes, but I do have history with the company. So my name is Prabha. I'm a registered dietitian. I have over 5 years of experience specializing in nutrition education and counseling. I got my degree in clinical nutrition at Oregon State University, so go Beavs. And then I did my internship at California State University through Sacramento. So stingers up if anybody is from around here. I put in my website there if you're just curious about more of what I do, who I am, what got me into nutrition, and the free resources that I offer. I don't want to overwhelm our time, our limited time with talking about myself, but I want to jump down to that last bullet, nutrition at Mexico Bariatric Center. So that will be who you reach out to if you have questions after this webinar that I didn't answer. If you still haven't gotten in touch about pre-op or post-op diet, or have questions about vitamins, you want to reach out to nutrition at mexicobariatriccenter.com. We just hired a new nutritionist, so she's catching up on everything and doing her best to answer your questions, so that patience will be well appreciated during that time. Wonderful. Okay, enough about me. Let's talk about the agenda for the pre-op portion. So the pre-op portion, we're going to be talking about the purpose of the diet. Then we'll be talking about what it consists of and my tips and tricks. And then I'll open it up for some Q&A before we jump into the post-op diet information. So the purpose of the diet. So the purpose of the diet is actually not weight loss. It's actually to shrink the liver. So the surgeons actually have to lift the liver out of the way during the procedure. So the smaller it is, it decreases the chances of complications. So that is the main purpose. Weight loss is just an added benefit along with the diet. It's also to help focus on the quality of food sources and beginning that behavior change. So not all food is built the same. We'll discuss how to make food choices based on the quality and promoting your overall health. And then we'll be talking a little bit about reading food labels, that meal prep aspect, and just gaining overall awareness about your nutrition. So your pre-op diet is going to be assigned based on your BMI. So everybody will be doing a 2-day clear liquid right before surgery, but the length of the rest of your diet, where it consists of the low carb diet portion, will vary depending on your BMI. So for example, if your BMI is 33, you're only going to be doing a 5-day low carb diet and then a 2-day clear liquid portion, and that'll add up to your 1-week pre-op diet. If you are BMI of over 60, for example, on the other side of the spectrum, you're going to be on the low carb diet portion for that 6-week period, but 2 days before surgery, you'll switch to that 2-day clear liquid. So I hope that clarifies that duration for you guys. Sometimes if you guys are in the Facebook group, you'll see some people have been on the diet longer than you. So just keeping in mind that's because of the BMI assignment. So let's talk about the pre-op diet, what it is, what it consists of. One thing I wanted to mention is some of the dietary changes that we have to make going into surgery. So going into surgery, you are going to want to take out alcohol leading up to surgery 2 weeks before. You're going to want to be taking out coffee 2 weeks before. You're going to be taking out caffeinated products, so the coffee and then any caffeinated teas, any energy drinks, you'll have to discontinue those 2 weeks before. So the big reason for that is just the reducing the blood risk, the bleeding risk, and as well as just setting up your stomach. Some of these caffeine products can irritate the stomach and lead to heartburn or GERD symptoms. So setting up your GI tract so that we're limiting those symptoms going into surgery and then hopefully decreasing those symptoms that you have post-op as well. So we're just priming your GI system right now. And we won't be having any caffeine either in that early post-op period too. So down the road, long down the road, you can consider adding coffee back in, but just know there's going to be a big section of time where you're going to have to be caffeine free. So start taking the dietary changes now, start making those modifications, cutting back, and that's what's going to suit you best so that you have less of those withdrawal symptoms. I'm a fellow caffeine drinker too, and I know I've had periods in my life where I've had to take caffeine out as well. I think earlier the last year, I had to go a 3-month period without caffeine, and it was difficult, but what really helped was weaning myself off slowly. So it wasn't such a harsh change, and knowing that the withdrawal symptoms are temporary. I also have a tea product on here if you just like the taste of that coffee to kind of have an alternative, but without the caffeine aspect. So the T-Cino is right there. Then I want to talk about the food aspect of things. So generally speaking, you're going to be following a low carb diet, and the focus is going to be 2 to 3 meals daily of solid food. So the reason why I promote the solid food first is because this will promote that feeling of fullness. Liquid nutrition, some people like to rely solely on shakes. The liquid nutrition is only going to stay in your stomach for about 2 hours, and it's going to empty out, and it's going to leave you feeling hungrier. So that's just something to keep in mind as we go along, is to really emphasize that solid food whenever possible. So 2 to 3 meals of that solid food. Food first is always my motto, and also just for your enjoyment. I know for myself, I'd rather a cooked meal over a shake personally. Protein sources should be lean on this diet. You're going to want about 4 to 6 ounces of lean protein per meal. We got great options listed here on the slides. Again, avoiding those fatty cuts, avoid any fried versions or processed meats, and leaning into these lean proteins. So we got chicken, beef, eggs, fish, pork, salmon is great, seitan, turkey, edamame, shrimp, tofu, beans. So you can rely on your plant-based sources, your vegetarian sources, as well as your meat products. Then we got our vegetables. So our vegetables are a great component of the diet as well. So I always encourage filling up at least half your plate with the vegetables, and these can be eaten very liberally. The vegetables are important because they're going to add fiber content to your diet, and they're going to be low calorie in general. So you don't have to worry about the caloric load. So generally the fiber component is indigestible carbohydrates, so it's going to have little effect on your blood sugars. So if you're somebody who's been managing high blood sugars or has diabetes or pre-diabetic, this is something to take note. The fiber is going to aid with stabilizing those blood sugars. It's going to aid with satiety, with that feeling of fullness, and it's going to promote bowel regularity. The vegetables especially can aid if you feel like you're constipated pretty often. This is a very important part of your diet. So we got all the vegetables listed here on the left-hand side: cauliflower, cucumbers, your leafy greens, broccoli, carrots, green beans, tomatoes, zucchini, Brussels sprouts, onions, peppers, pickles. We do have on the right-hand side within that little X are some of our starchy vegetables. So generally in a diet, these are great to incorporate, but right now, when you're on the pre-op diet, we want to eliminate these starchy foods because they are going to create work for the liver and can lead to the liver not shrinking to the size that we want it to. So we're going to be avoiding potatoes on this diet. We're going to be avoiding corn, peas, squash, and pumpkin. So that's where this is kind of different from some other weight loss diets that maybe you saw. The reason why we're taking out the starch component is, again, for shrinking that liver. So that's where it differentiates. I just had a question, what about mushrooms? Yes, you can eat mushrooms. So I apologize, not everything's listed on here vegetable-wise, but generally all vegetables are okay except for that avoid list, okay? So potatoes, corn, peas, squash, pumpkin. Wonderful. Healthy fats. So I do encourage you to include some fats in your diet. I think there are some misconceptions going around that fat makes you fat. And I want to clear that misconception. That's very black and white thinking. That statement is neglecting to focus on the quality of fats that you're intaking, and it's actually an essential nutrient in your diet. It's required. So I promote the intake of unsaturated fats. Sources are listed here on the screen for you, and avoiding saturated fats. So saturated fats are going to be in products like butter, fatty cuts of meat like ribeye steak, fried foods, baked processed goods. Those are things that we want you to be eliminating. But these fats here listed on the screen are important for hormone building, for absorbing fat-soluble vitamins, to promote overall health. If we're not intaking those fat-soluble vitamins, that can lead to other nutritional deficiencies and unintended consequences. So really important to still incorporate into your diet. I will mention that one thing to keep in mind with fats is that they're a higher caloric load compared to our proteins and carbohydrate sources. So with that in mind, we do need to make sure that we're portion sizing correctly. So if you're having something like a nut butter, I would limit it to a tablespoon for a serving. If you're doing like an avocado, slice that avocado in half and just have half. Something like almonds, I would just do a really small handful, like 15. So things to keep in mind. If you're doing dressings, generally dressings I try to keep at about 1 to 2 tablespoons. Somebody asked a great question, is mayo okay? I put a lot of those veggies in tuna salad. That is wonderful that you're incorporating vegetables into your tuna salad. For the mayo, I would try to find a dairy-free source. One that I'm aware of is called Veganese. Let me see, I'm going to try to see if I can type that into the chat box so you guys have that available for you. Veganese. Okay. I don't know if I spelled it completely right, but I tried my best, and it's a good enough that you could look it up, but it's called Veganese. So that would be another option you could use instead of the mayo. What do they say in regards of MCT oil? So those are medium chain triglycerides. Those can be helpful. A lot of times I'll see them incorporated with, if you're taking like a collagen supplement or some of your protein supplements, might have that MCT oil added on. So those can be great because our body absorbs those pretty well. And so that can be a helpful part of your diet, but just keeping in mind that there's going to be a little bit of a caloric load with that. But if you're eating some of these foods on the screen, I wouldn't be too worried about having to take MCT oil. But if you feel like, okay, I'm not eating a lot of these healthy fats, then that's where I would consider having that supplement on board. Because again, supplements are supplementing the diet. Is fat-free Miracle Whip okay? If it has dairy in it during the pre-op diet, I want you to be avoiding it. So that is something I'd have to look up on my own time. Can I drink decaffeinated coffee? Yes, you can drink decaf coffee. Okay, let's move on from fats. Optional, so you can consume some fruit daily. We recommend about a half a cup daily. And some of the best choices are berries, just for that fiber source, and they're really good for your cognitive health as well. Fruit, we are limiting in general. The big reason for that is while it consists of healthy natural sugars, we are trying to limit any sugar intake that is going to make work for our liver. Again, we're trying to reduce and shrink the size of your liver. We also want to make sure that you have good blood sugar control going into the surgery as well. So that's why the fruit is limited. In a general healthful diet, before bariatrics, we would want you to be eating more fruit, but this is a change for the surgery. Soup, we have on our pre-op diet guide a recipe for the unlimited magic soup. This is very popular among our patients and really tasty. So I definitely recommend And we'll have some more recipes coming up here soon. So we talked about the foods to include. These are the foods that we want to be avoiding and taking out of our diet during this time. So this will include those starchy foods we talked about, because starchy foods are going to break down into sugars. And while they're natural sugars, again, it's creating work for our liver. Same with the fruit. They break down into sugars, creating work for our liver. So we want to be limiting bread, pasta, rice, no tortillas, no baked goods, limiting that fruit to just a half a cup. Sugar, we don't want any added sugar products. So it's very important to be reading your nutrition labels. I really recommend too to make sure when you're looking at a nutrition label, especially for those protein shakes that you're consuming, to be looking if there's added sugar involved. Sometimes those added sugars, somebody had just sent me like a carnation breakfast a little while ago. That has a lot of sugar in there. There was like over 10 grams of sugar. I almost want to say there was more sugar than protein content in it. So something to keep in mind, make sure you're reading your labels. We'll talk more about protein shakes in a little bit. We want to be limiting any processed meats. So we have some listed here: bacon, salami, bologna, sausage. We'll be limiting those starchy vegetables, those potatoes, corn, peas, pumpkin, butternut squash. We'll be limiting dairy. Again, dairy is going to break down to natural sugars, lactose, creating work for the liver. So we're going to be taking out milk, cheese, yogurt, cottage cheese. We're going to be removing alcohol during the duration of your pre-op diet. And we're going to be eliminating drinks containing added sugar. So your soda, sweet teas, even juice, we'll be wanting, you can have 100% juice if you dilute it with water. So juice is a very concentrated form of your fruits. And with that being very concentrated, there's going to be a lot of sugar load with that, whether or not it's added or natural. So if you're going to drink juice, I recommend 100% juice, and you can do 4 ounces mixed with water. Also, while we're on the avoiding, I want to talk about things that you have to discontinue leading up to surgery. So making sure that you discontinued alcohol, marijuana, any THC products. Again, these are going to include bleeding risk. Making sure you're discontinuing caffeine intake 2 weeks prior. Again, it's going to be a bleeding risk, and also it's a stomach irritant. And we're trying to minimize anything that promotes GERD or heartburn symptoms before and after surgery. We also want to make sure that you're removing supplements leading up. So 2 weeks before, you're going to want to remove any supplements containing ginger, garlic, your omega-3, ginseng. These again are going to contribute to bleeding risk. You can cook with garlic and ginger. Those are small enough amounts, but I don't want any high quantity supplements. And if some of you are taking probiotics, I love that. That's really good for your gut health, but 2 weeks before surgery, you do want to remove it. And then you can add it back into your diet and your regimen 2 weeks after surgery. Wonderful. And then just a lifestyle change that I want you to start is stopping drinking 30 minutes prior to eating, and to stop drinking 30 minutes after a meal. So you want this 30-minute window before and after mealtime where there's no liquids ingested. And the reason for this is that it's going to aid with your digestion, especially during your post-op period. So if we're drinking a lot of liquids before mealtime, thinking about post-op wise, you're going to be filling up your small little stomach, and then you're not going to have as much room for nutritional intake that's nutrient dense. versus if you're drinking a bunch of liquids after you eat. Sometimes that gives a very unpleasant feeling where you're pushing a lot of your nutrition through your body. A lot of people will get bloated, nausea. It can lead to dumping syndrome, which can be very unpleasant. So something to keep in mind. We've got some recipes here. I recommend, if any of you have your phones out, to either take a screenshot of this page, or we have a little scan code in the top right corner. So you can scan that for the slides that will have the recipe on there. But generally for the recipes, I just want to highlight that you'll probably notice that there is a lot of vegetable content. So again, for the fiber, the satiety, the fullness, and for bowel regularity, low calorie component. And then there's a lot of protein in these to help keep you feeling full as well and maintaining your lean mass going into surgery. So let's show off some of these photos. Look how delicious these are. And we'll have some more opportunities to scan for the PDFs later on as we go, okay? Okay, protein supplements. This is probably the most common questions that I get when it comes to the diet. So for protein supplements, I do recommend having 1, maybe even 2 protein shakes a day. These can either be a pre-made shake that you're buying where it's already like bottled up, or maybe it's a powder that you're mixing in with something. If you're mixing it in with something, I recommend water, unsweetened almond milk, cashew milk, almond or coconut milk is great. I've even seen some people doing coconut water. Just make sure there's no added sugars in there and that it's unsweetened. When you're looking at protein supplements, aim for something that has 20 to 30 grams of protein and less than 5 grams of sugar. Now, your protein sources can consist of whey, a combination of plant-based, collagen, or egg white. So something to keep in mind with the whey is a milk protein. So if you're picking out your protein supplements, try to pick one that is hydrolyzed whey, where part of that protein, that milk protein, has been removed, where it's just the casein and not the lactose, the sugar component. So if it's lactose free, you're okay. We want to be taking out, you can do hydrolyzed, so it'll either come out as hydrolyzed or it'll be casein, C-A-E-S-E-I-N maybe is how it's spelled. But those forms are okay when it comes to whey. But if it straight up says it contains milk, it contains dairy in the ingredients list, then we need to be avoiding it. So what I said earlier, pre-made shakes, powder, we have the recommendations here on the right, and then I put in a picture of a nutrition label to just give an example of looking at a good quality supplement. So you can see in this one, for 2 scoops, the serving size says 2 scoops, that it provides 21 grams of protein. So we hit the nail on the head with that minimum requirement protein. And if you look at sugars, it says 1 gram of sugar. So this is a great supplement to incorporate. Remember, making sure that sugar in general is less than 5 grams. So we have some plant-based options here listed. The plant-based options are going to be made primarily from pea protein, mixed plant, or hemp options. I will note that these ones tend to have a little bit of a different texture at times, a little more like chalky feeling. So sometimes what you're mixing it in with can help ease that texture change. These plant-based options are usually best tolerated post-op. So if you want to stock up on it pre-op to carry into post-op, that would be great. Another really great one that I like that I don't think I've listed on here is Sun Warrior. That's a great one. I love Garden of Life products. The Vega Protein Sport is the one where I feel like I really notice the texture one, but some people don't mind it. So that's just something to keep in mind. Protein powders that are more whey-based, egg white, or collagen-based are listed here. The Vital Proteins is great. These ones are usually, they have an unflavored option, so you can even incorporate it into, if you're making any soups or something, you want to add some more protein, that can be great as well. Again, we have another Garden of Life product there. I love Garden of Life. We have some GNC on here, Naked Egg, Naked Whey, Impact Whey protein is great as well. And then we have some pre-made shakes. So these ones, you want to make sure that there's no milk protein listed, and that if there is milk listed, that it's saying that it's isolate or hydrolyzed forms. And so here's some options here. I do want you guys to be mindful with the Orgain products to really be reading the nutrition label, because some of their products do contain dairy and some of their products don't. So you really need to be mindful. A lot of these companies make a lot of variations of their products. So while in some forms they're okay, in others it may be problematic. Good. Okay, so then the clear liquid portion. So this is 2 days before surgery. You're going to switch to clear liquids. This is going to be any water-based product. So water you're allowed to eat or drink, coconut water, no sugar. You can do clear broth or bouillon cubes. I recommend stocking up on some bouillon cubes, especially if you're traveling, because you can just ask for some hot water when you're traveling and make your own broth. I recommend a vitamin water, Zero or Propel, Crystal Light, Powerade Zero. Those have great electrolytes in there too to maintain your hydration. Sugar-free Jello's okay, sugar-free popsicles. You can do juice diluted with water. So again, 100% juice, up to 4 ounces of the juice, and that can be mixed with water. And then protein waters are great, the zero sugar options. So some options I see often is Isopure is great, Protein 2.0, Body Armor has some. Just be mindful that you're picking up an option that has no sugars in it. And then I also get questions frequently about the bouillon cubes. You know, is this too much sodium? When I'm looking at the nutrition label, there's a lot of sodium on here. So I love that you guys are being mindful of those nutrition labels. If you have a heart condition and you've been advised by a physician to watch your sodium intake, that is something to be mindful of, right? But for some of you who do not have heart conditions, the sodium actually can be a little beneficial at this time, because if you don't have a lot of intake or hydration, the sodium is actually going to help retain your water. So it's going to help with keeping you hydrated. So in this brief period, the bouillon cubes would actually be beneficial for those of you without a heart condition. As for medications, I can't answer medication questions. That's not in my scope of practice, and neither can the nutritionist as well. So if you have questions about medication, please reach out to our surgical liaison, Jen, jen@sources.com, or we have her phone number on here. This is who you'll want to contact about, are there medications that you need to discontinue, and when to discontinue, and when to restart. Okay, so I want to pause here for some Q&A and hear what you guys have questions about, and then I want to hop into the post-op diet. So I'm going to read a few of these. I'm going to rehydrate here, so don't mind me. And maybe this is your sign to hydrate as well. So drink some water. Okay. I'm looking at the Q&A box right now. Okay. So I answered the mayo question. I've heard mixed things about Premier protein shakes. They have dairy, so some say no, but I've heard they're fine. Are they okay? Yes. So the Premier shakes, if it's listed as hydrolyzed whey or isolate, then you can consume it. If it just says milk protein, then I would avoid it. So it really depends. Some of their products are okay and some of their products aren't. So that's where you really have to be mindful in looking at the nutrition label. Are we allowed turkey sausage? Yes, turkey sausage is great. And I want to say Applegate has a really good brand of turkey sausages out there, and like chicken sausages as well. What drinks with 0-calorie sugar substitutes? Okay, we already listed that on here, so I hope we answered that question for you. I had a question about birth control. That is a question for Jen and not for myself, unfortunately. Is elderberry okay? Yes, so elderberry is commonly taken to help with immune support. Generally speaking, I would say I wouldn't be concerned about elderberry. You could take, I know there's a lot of teas with elderberry, so you're welcome to have like the tea form. I would avoid any capsule form where it's really concentrated. But you can have like the teas that have elderberry if you're using like some sort of oil. Vitamin C might be a good thing, like those little emergency packets to bring along with you while you're traveling for that immune support. Great question. How soon should we stop taking supplements prior to surgery? 2 weeks before and 2 weeks after. Should I discontinue THC products? Yes. Can we use any broth for the liquid diet? Yeah, so you can use any broth and just making sure, you know, you can do the chicken, beef. I've even seen there's like some like fish, like seafood version. Vegetable stock as well is good. And just be mindful if you do have a heart condition, you've been advised to have a low sodium diet, that you're going to want to look for low sodium options or lean more on those vitamin waters or protein waters. Is Vital Protein Collagen Water okay? I don't know if this is referring to the protein collagen or the Vital Protein Collagen packets in your mixing it with water, but that's fine. That's great. Okay, so I'm going to move on to the post-op diet. So let's move forward. I'm going to reintroduce myself in case any of you just popped on for the post-op version. So again, hello, my name is Prabha. I'm a registered dietitian. I was with the company a while back and temporarily back just to do some webinars. But generally speaking, you'll be speaking to a different nutritionist when you're getting guidance at this time. But about me, I have 5 years of experience specializing in nutrition education and counseling. I have my degree in clinical nutrition from Oregon State University, did my dietetic internship at Sacramento State through California State University. I have my website listed there in case you want to just hear more about my story, why I chose nutrition, any of my free resources is all on there. And then generally speaking, for nutrition from Mexico Bariatric Center, you want to utilize this email address below. And this way you can speak to our new nutritionist. We are transitioning. Brittany, our previous nutritionist, left. We have our new nutritionist here, and so she's catching up, learning all these new skills along the way. So just have patience and tolerance during that transition period. So today for the post-op portion, we will be talking about the 4 phases of the diet. We're going to be talking about nutrition goals for that 1 month and beyond in long term. We'll have some sample meal plan on there. I'll give some tips and tricks. And then we're going to be talking about Just lost my words there. Then we're going to be talking about vitamin supplementation for you guys. Vitamins are going to be extremely important. We have our own vitamin line called Emerge Bariatrics. So we'll discuss that at the end, and then I will address all questions recapping. So first, we're on the clear liquid phase. So just like that 2-day clear liquid diet, you're going to be back on another clear liquid phase. Probably about, some people can even just do 3 to 5 days. Some are 5 to 7 days. So keep in mind during this post-op portion, the days vary. So it's really based on how well your toleration is. I would generally say if you have 5 days of good toleration on any of these phases, that is your green light to move forward to the next diet phase. So these are kind of loose guidelines that we have listed here for the days. And why sometimes on Facebook, you might see somebody is way ahead of you. So not to freak out, everybody's body is different. And unfortunately, this is one of those things that I can't predict for you and can be kind of frustrating during this process. But these are general guidelines I want to share with you to help ease this whole process. So clear liquid phase is going to be an additional probably about 5 to 7 days for most. The point of this is to allow the stomach and digestive tract to rest. And the critical focus at this point is going to be hydration. So the hydration is going to be very important because dehydration is one of the leading causes of hospital readmission after surgery. We want to be trying to get 64 ounces of water, and the absolute minimum I would say is about 48 ounces. So if you are getting less than 48 ounces, for multiple days, I would recommend going to an urgent care or somewhere where you can get IV nutrition, because we want to make sure that you're hydrated. So generally speaking, your stomach is still recovering, water might irritate it, and we have to be taking sips, not gulps is what I say. Sips, not gulps. So we want to be taking very small sips throughout this. It's like a teaspoon at a time. Wait 60 seconds, see how you're tolerating that sip, and try to sip a minimum of 4 ounces per hour. One thing to keep in mind with the fluids is we don't want to be using any straws. The straws can be aiding you with intaking excess air, and if you're taking in excess air, it can lead to digestive discomfort. A lot of people can sometimes have a hard time with the water toleration at first. So just remember, you have a whole new GI system right now. Depending on your surgery, we may have switched your GI pathway. So your body's adjusting, and to be gentle with it. Sometimes altering the temperature of your water can help with that toleration. I find for some that water that's warmer can help soothe and relax the pouch muscles. On the other end of the spectrum, I hear that when you are very nauseous, that you prefer more of the colder, like ice cold type of liquid. So something to keep in mind, play around with. Some people find that bottled water works better depending on like the alkalinity. I don't see much evidence that's science-based, but just anecdotally, I'm hearing that having the bottled water in certain pHs can be helpful. Keeping in mind that fluids are not going to harm or stretch out your pouch the way that excessive food can do, and liquids will pass through your system without restriction. So stay hydrated. Cheers to sipping some water while I move on here. Okay, so some options to try. I recommend like herbal teas, making sure you're not drinking any caffeine. You can do infused waters, the broths, the bouillon cubes, Homemade popsicles are great. Water, Crystal Light, lots of options out there. I would just avoid the acidic and caffeinated teas. These can lead to GERD or heartburn. Same with coffee, caffeinated products. The caffeine too is going to dehydrate you, so it's going to be kind of working against you. So more reason to be avoiding that at this time. Citrus, also going to be acidic, so you're going to want to be limiting those, and anything carbonated, so no carbonation at this point. So during your pre-op portion, you may have been drinking some seltzer waters or whatnot, but during this portion, we don't want anything that's carbonated. Okay. I highly recommend sugar-free liquids with electrolytes to replenish your body and prevent further dehydration. I love the protein waters, especially because they help maintain your lean body mass. So for those of you who are kind of on this clear liquid portion for a longer period of time, I would really recommend incorporating these protein waters. I'm going to move on to our thick liquids. So for thick liquids, this is going to be 5 to 7 days after your surgery. And the big emphasis here is going to be protein intake. So if we're not intaking enough protein, this can lead you towards malnutrition. So no matter your body size, you are still at risk for malnutrition. And when malnutrition happens, the body experiences nutritional deficiencies, electrolyte imbalances, muscle loss. So we don't want the muscle loss to be confused as weight loss. We don't want you losing muscle. So it's very important to make sure we're getting our protein intake. At this beginning portion, it'll be 60 to 90 grams. The protein is going to help with wound healing. It's going to help burn fat instead of the muscle, so we retain that muscle. And we're going to want to maintain that hydration goal we talked about, the 64 ounces. And if you are 14 days past surgery, then you can start your vitamin supplementation. And making sure, reminder, that we are not using straws. So here are some great thin liquids. We've got blended soups. One thing I'll note with the blended soups is if it's tomato-based, sometimes the acidity can be irritating. If it's dairy-based, a lot of people are lactose intolerant temporarily after surgery, and that's just because of all the inflammation in our GI tract and our body's healing. So avoiding those cream-based, dairy-based soups, and any soups that have a lot of beans in it. For some people, they're more prone for an early digestion of beans, which then is going to ferment, cause gas production, and lead to bloating and to gas in your stomach, which can lead to uncomfortable pains. So just something to keep in mind. It's not one size fits all. Some people can tolerate just fine, others don't, but just some considerations that I'm sharing with you. Protein shakes will be vital, and that's why we need those protein shakes to be high protein content per serving, because you're only going to be able to intake so much. So we need very concentrated sources of protein. You can do fruit and vegetable purees. I put more emphasis on the protein at this time, but if you're able to intake you're tolerating it pretty well, then fruit and vegetable purees are great. You can even add like a clear protein powder like Gen Pro or the Vital Proteins in with any of these purees. Thinned refried beans is great, or you can puree the beans and lentils. Again, just making sure that they are gas producing for some, so just having that in mind. And we want to be avoiding any flavored yogurts, ice cream, sorbets, sugar-based products. Even smoothies from a chain restaurant tend to have a lot of added sugars, or it's a lot of concentrated fruits with natural sugars, and it's just a high intake all at once. We also want to ditch the old method for bariatrics was relying on baby food, but some of the baby food can have added sugars as well, so we don't really want to be leaning on that as much if there's added sugars. Fairlife milk is a good alternative for the dairy, just because there's no lactose in it. So again, I said after surgery, you may be temporarily lactose intolerant due to inflammation. So this is a great option for better digestion, and you can still get protein along with this. And it usually has lactase in there, a digestive enzyme to help better tolerate any sort of dairy intake altogether. And some of these products do actually just have digestive enzymes available in it. So more recipes. So if you have your phone out, please welcome to take a photo. You can also scan the little barcode on your camera portion of your phone. So I'll pause here so you guys can take photos, and I'll just discuss some of the stuff. I recommend if you're doing oatmeal to thin it out with some almond milk or dairy alternative milk to just thin it out more, avoid textures that are gummy. Anything that's gummy textured might cause some blockages. You can also even puree it in the blender too if you're wanting to just make sure it's that right consistency. We've got a soup recipe. Again, I said avoiding heavy cream-based soups at the beginning, and sometimes those bean and tomato may be irritating as well. And then a protein shake on here. I definitely recommend too trying to find another protein shake that has more leafy greens in it. And the reason for that is just the added fiber. The leafy greens add fiber that'll help with bowel regularity, which is a common complaint after bariatric surgery. So to get the bowels woken up and going again, I promote that fiber intake, active movement, so trying to walk as much as you can. Getting adequate fluid intake as well will be really important to aid regular bowel movements. So we got our wonderful pictures. And now we're going to move on to phase 3. So this is the solid soft phase. So this is 10 to 21 days. Again, this is going to be introducing soft foods into the pouch, really emphasizing that 30-minute window before and after food consumption to have free of any liquids to aid with that digestive comfort. During this portion, food must be able to mash with a fork, making sure all your meals have protein incorporated, and making sure you're eating slowly to aid with digestion and chewing your food properly to an applesauce consistency. I recommend introducing one new item at a time just to make sure that you're having good toleration. Keeping a food log to see and track what you're intaking well and what you're not, that'll just help you build a better routine and better toleration of your diet altogether. And generally too, when I was working with MBC and patients were telling me that they were having poor toleration with food, I would always recommend that they kept a food log, and then we'd review it together and figure out a meal plan for them that would work. So that's going to help your nutritionist out here with her helping you come up with meal ideas. So make sure you do get like a little journal and you're writing it down or you're taking pictures of your food. It's going to be very important. I also recommend getting a food scale, and this might be good too even during pre-op just to kind of understand portion sizes. You don't have to do this every day, every single meal. But at the beginning, I recommend just so that you're formulating what an adequate portion size is. So during this early post-op, your food intake should kind of be more on the lighter side of 4 ounces. So primarily protein, about 2 to 3 ounces of protein, an ounce of carbohydrate, and have a teaspoon or a tablespoon, pardon me, a tablespoon of fat on there. Again, that lifestyle behavior, making sure you have a liquid-free window 30 minutes before and after meal time to aid with digestion, no fluid intake during that time. In chewing your food, like I said, I would opt at this point, if you can, to get 3 meals a day and at least 1 protein shake. The more you can spread it out, the better toleration you're going to have. And the recommended protein at this point is 80 to 90 grams. So here's some options of some soft, solid foods listed here: cottage cheese, avocado, tuna, mayo, tuna with the mayo, Greek yogurt, scallops, poached or scrambled eggs, baked salmon, beans, braised meats. So meats that have been cooked for a long period of time will be better tolerated because it's more broken down. Well-cooked vegetables will be better tolerated versus raw vegetables. So we don't really want to be eating anything raw at this point. So no raw vegetables, no white bread, no steak, popcorn, no hot dogs, cookies, desserts, no processed products and snacks. So we have some more recipes here, so get your phones out to screenshot. Otherwise, if you've already scanned, you're good to go. We have an avocado chicken salad, a low-carb pork roast, and then a cottage cheese egg salad. I'll pause here, so if you're taking photos, I'm not taking away your recipes. All right, and there's our beautiful pictures. And then the last phase, solid phase. So this is what you should be incorporating for long term. So it should include a variety of foods. You should be able to tolerate most things at this point. It comes down to choice about what you want to introduce back into your diet. I would prioritize those protein sources first, just so you have more variety with getting your protein intake in. Making sure you're giving yourself 30 to 45 minutes minimum for a meal time, pacing yourself well. Adding 1 new food item at a time, making sure you stop eating before you're too uncomfortable. So we don't want to be eating past fullness. And it may take some time for your body to really adjust. Some people, they say, oh my gosh, I couldn't tolerate eggs like at all for 3 months, but then they tried adding it back in down the road and they actually could tolerate it. So be patient, try adding things a few times before writing it completely off. And you're just going to have to relearn your GI system and what foods are going to work well for you. It really is tailored. Long-term intake, I would actually say you can do about 3 to 4 ounces of protein, 1 to 2 tablespoons of fat, and 2 ounces of carb. So things to be cautious of. So I love this slide, and this is going to be very important. Some things to consider if you're having trouble with some foods. So raw vegetables in general are really hard to digest at the beginning. So prioritizing those soft cooked foods over something like a salad in those first few months. For some people, eggs, they tolerate well or they don't. Sometimes I find that poached eggs are better tolerated, or maybe it's doing a scrambled egg, and then further down the road, maybe it's a hard-boiled egg that you're mixing with some mayo to do like an egg salad sandwich. Tough meats are going to be more difficult, so the longer you're cooking it for, those more braised versions are going to be better. Those moist meat cooking is going to be better tolerated. Avoiding white rice and regular pasta tends to have a very gummy texture, and if we're not altering that texture, sometimes it's going to lead to blockages, and a lot of times too, not as much nutritional value compared to quinoa or brown rice if you have a sauce on board, or a lentil pasta. Fruits. A lot of times the citrus is still hard to tolerate, so opting for something like berries. Carbonated drinks are hard to tolerate as well, so aiming for water-based products that are sugar-free, that have flavoring, like some sort of infusion. Sometimes nuts are hard to tolerate, but having in the form of like a creamy nut butter may be better, especially something like almond butter may be a little better tolerated, or hummus too is a good protein source. So I want to pause here and see if there's questions about the diet, and then I want to jump into vitamins. I'm going to very briefly look at questions because I want to make sure we get the vitamin supplementation guide kind of presented to you guys before you guys are signing off. Does stopping supplements also include multivitamin? Yes, so we'll have you taking that out. Generally, your diet should be providing you with what you need, that temporary gap shouldn't be an issue. Are Plexus Slim packets okay? I'm assuming not, but worth checking. I'm not sure about that. I have to look at the nutrition label for that to give you a positive answer. So I would recommend sending it to the nutritionist so she can review it and let you know. What are some high protein alternatives I could eat for breakfast? Eggs are making me nauseous. You could try like the beans, maybe, I don't know if this is that you're post-op. And I don't know if this is connected to the same person. It says I'm 4 weeks post-op and feel hungry all the time. What should I do? You could also do like a soup if you wanted to, and add in like a protein powder in there, like the Gen Pro or the Vital Proteins in there. You could even do like the nut butters in like a thinned out oatmeal. Maybe you want to do hummus. You could even do like some canned tuna even would be a good option. If you wanted to make like the inside of like a tuna salad but without the bread. If you just want to do like the mayo with tuna, that could be good. Just some options. If you're 4 weeks post-op and still hungry, I would reach out to our nutritionist and meal plan with her. What should I do if I hit a stall? We'll kind of jump into a little bit of this, of the long-term eating here in a second. Is vegan Shakeology okay? Again, send the nutrition label to the nutritionist. And yes, you'll be getting all this information before leaving the hospital. Okay, so let's look at the long-term goals here really quick because somebody asked a question about that. So long-term, I want to make sure that everybody's tolerating food. It's going to be different person to person. So keeping that log for yourself is going to be important to identify the foods that work well for you. Typically, within a year, you should be able to intake about up to 9 ounces of food, but I really want you to keep meals 4 to 6 ounces at a time. And it's normal for over time, your stomach will kind of stretch, it'll adjust. But again, I don't want you going over 6 ounces repetitively because that is going to be what leads to long-term stretching out your stomach again. Okay. And again, do not force food in. If it feels uncomfortable, that's your sign to stop, okay? So long-term goals, I want you incorporating those fats in there. As I mentioned earlier, I think there was a misconception circling around that fats make you fat, and that meat will have too much fat. So this is very black and white thinking. It's going to neglect the quality of fats and the added nutrition in some of the meat products like iron that meat can provide. And a lot of times iron is a deficiency with a lot of bariatric patients. So you're okay if you want to choose meat options for your proteins, and you're a-okay to be adding fats into your diet and opting for unsaturated fats, because those unsaturated fats are going to help with hormone production, and they're going to help absorb fat-soluble vitamins. Carbohydrates are still going to be important for the added nutrition, the micronutrition they provide, vitamins, minerals, and even some of that starchy component, like with the oats and the potato, the beans, legumes, pseudo cereals, are going to be important for an energy source as well. So all important parts of the diet. I know a lot of times I get asked what are pseudo cereals. So they come from plants, and they're going to include your quinoa, buckwheat, amaranth, chia seeds. Those are all grouped within that. High fiber intake with those. Again, fiber is going to help with the bowel regularity, with feeling full, and blood sugar control. Nutrition goals. So at the beginning, you may not be getting a whole lot of intake in, and you're going to build yourself up. Again, that nutrition is not one size fits all. So these are just general guidelines. It's okay if you're not strictly within this. Generally, longer term, 1 month out, I would like you to work your way up to 1,000 to 1,200 calories. At the beginning, you may be more at like 800, and that's okay. It's important to start getting your body moving early post-op, so that we can increase your intake towards that 1,000 and 1,200 calories and still be in that good energy balance, that energy in versus energy out, and having a balance between the two. And generally, while we're on the topic of exercise, making sure that if you're doing any weight-bearing exercises, that you're following the guidelines given to you at post-op. I think generally it's 6 to 8 weeks, but it depends on the surgery you get. So not one size fits all, but these are some recommendations: 1,000 to 1,200 calories, 35% protein, 30 to 35% carbohydrate, and 35% fats. And I would say too, if you're somebody who tracks your food intake, it's excellent to getting that awareness of what you're intaking if you're reaching goals. I would try to keep sugars down, added sugar specifically, under 25 grams, and try to get fiber intake above 20 grams. And making sure you have good hydration, otherwise the fiber intake is going to be a little bit hard on your GI system. And so we have a sample meal plan here for y'all. Let's jump into vitamins for this last 15-minute portion, and then I'll just take a look at questions, okay, you guys? Thank you for hanging tight with me. So why are vitamins important? They're important because if we have nutritional deficiencies, these vitamin gaps, it can lead to fatigue, blurred vision, nerve damage, muscle loss, cracked, dry skin, health may be compromised, you may be feeling weak. It contributes to your bone health, hair loss. So these are all things that we want to prevent. So again, if you have your phones out, I recommend taking a screenshot of these lovely charts. Otherwise, this is your last chance to get that scan code today. But I love these charts. They're going to help you create your vitamin regimen. I recommend too to follow up with the nutritionist about this. When she calls you during pre-op, discuss your vitamin options, or even post-op, discuss your vitamin options and how you'll reach your goals. Generally speaking, you're going to want a bariatric specific multivitamin. The multivitamin is going to have high quality, high quantity amount of general vitamins and your fat soluble vitamins. So it's important to have the bariatric specific one. In the bariatric specific one, you'll notice if you look at a nutrition label for it, in the daily value percents, a lot of those daily value percents will be over 100%, because your bariatric surgery is going to put you in a position of malabsorption. You're not going to absorb everything from food, and that's why vitamin supplementation will be crucial. So you'll have your multivitamin, and then we'll have your calcium, preferably with some vitamin D on it to help with absorption. If vitamin D is not included in your calcium supplement, then you're going to want to add in a supplement of vitamin D. You need sublingual vitamin B12. So it can't just be the little capsules that you're taking. It has to be sublingual, which means it's going to go either like a little tab that goes under your tongue, or it's going to be like a dropper. You can also get with your primary care B12 injections. That's probably what I see most common. So reach out to your primary care to set something like that up. Making sure your bariatric multivitamin has thiamine in it and B complex. Making sure it has iron. So iron will generally be a separate supplement from your bariatric multivitamin. And the iron, you want 45 to 60 milligrams. If it has vitamin C in there, that's a huge bonus because that's going to aid with the absorption. And then we have zinc and biotin. So these are optional, but more emphasis for that hair health. So making sure if you're having hair loss that you're intaking enough protein and that you have these supplements on board. Generally, your multivitamin will include the zinc and biotin, but it's just something to keep in mind. On the right-hand side, we have specifically for duodenal switch. Because we've done a little more invasive surgery, you do have higher recommendations. So keep that in mind. So generally, if you are going to take our Emerge bariatric vitamins, your supplementation will generally consist of a multivitamin that's bariatric specific, an iron supplement with vitamin C, a B12, and a calcium citrate with that vitamin D in it. So that's just something to keep in mind. If you choose something other than the bariatric Emerge supplements, then this may change. Okay, so these are our products, Emerge vitamins. We have a promo code on here to save 10%, and we have the website here. And I'm going to review very quickly in the next 10 minutes a little bit about these products for you guys. So the first one I want to discuss is our liquid vitamin supplement. So it's a powder that you'll mix with water. This is a multivitamin, plus it has some calcium citrate in it. There's a little bit of fiber in there and some electrolytes. I find that this is usually well tolerated for people. One thing to keep in mind though is that if you're somebody who's having a harder time with getting your liquids in, this may not be your prime option. So keeping in mind, this works best for people who have been able to intake their liquids. But this can be a good one to start out with. Another one I recommend starting out with is our Emerge soft chews. These are pretty well tolerated as well. easy for your body to absorb, fill your vitamin recommendations. We have a few different flavors right now. It sounds like we have a multivitamin that's strawberry and an iron that's pineapple. And then we have the chewable options. So these ones I recommend for a little further down your recovery because they're a little bit harder to tolerate right off of post-op. But if you're a little more like 3 months out, then this might be a better option that would give you some cost savings. This one, good vitamin absorption, fills your recommendations. And again, you want bariatric specific because it's going to have that higher quantity and it's not going to come with a bunch of sugars in it. So I kind of want to discuss that a little bit more about what I said about the sugars and why the bariatric specific multivitamins and supplements are a better option. So if you look at this table here, on the left-hand side, we have the Emerge products. On the right-hand side, we have a general Centrum adult multivitamin and then the gummy version. So remembering that when you're bariatric, you have higher nutritional needs. You're malabsorbing, you're not getting all the nutrition through food anymore. So we are relying on these supplements. So you can see how the numbers on the left-hand side are higher than the ones on the right-hand side. You can see, I think one of the best examples is, for example, DS patients. You need to be intaking 10,000 IUs of vitamin A. So when you look at the right-hand side with that Centrum multivitamin gummy, that only has 2,000 IUs in it. So you would have to take, there's 2 gummies per serving, so you have to take 2 times 5 servings to get to where you need to be. So that's going to be 10 gummies to reach your vitamin A nutritional needs, right? With 10 gummies, that's going to be adding a lot of sugar on board. That's going to be at least 10 grams of sugar that you've just added on just with your multivitamin supplement. So you can see if generally long-term we're trying to stay under that 25 grams of sugar, now we're already hitting about half of our sugar intake with just your multivitamin. So that's why the Emerge products are better, because you can see there's 0 sugar, right? So with that 0 sugar option, we're going to do better with being able to get to that 10,000 IUs. The chewable has 10,000 IUs, so you would only need 2 chewables to reach your needs. So just something to keep in mind, considerations. I think sometimes people try to cut corners with getting generic options for financial reasons, but in the long term, it doesn't equal out because you're not getting quality nutrition, you're having to take multiple, and then you're going to have to keep repurchasing them anyways. So things to keep in mind. A common question and concern we get is about preventing hair loss, specifically and other nutrition deficiencies. So these may happen in the first couple of months because you're having rapid weight loss, there's a lack of calories or protein, or maybe you're consuming bad quality vitamins or misunderstanding about vitamin schedule. It's really important to review this kind of thing with the nutritionist. On the vitamin schedule note, it's important to note that calcium and iron have to be taken separately. So on the right-hand side, we have a little sample schedule of how to take your supplements to avoid interactions, because calcium and iron are going to compete for absorption. So we want to optimize your absorption. So that's why we have a very specified schedule here on the right-hand side for the soft chews or chewables or the drinkable version. We have some bundles available through Emerge to help you reach your needs. We have our multivitamin, we have the calcium citrate that has the vitamin D in it, so that's going to help absorb. Making sure that if you're getting your calcium that you're choosing a citrate form and not carbonate. For iron, having that vitamin C on board helps for absorption, and sublingual B12, because a general B12 isn't going to be absorbed, so it has to be sublingual. Shots, the injections are probably what people do generally for this one, so reach out to your primary care for that one. Some other things that may aid is digestive enzymes to help with surgery. So I always recommend Garden of Life has a great digestive enzyme. Probiotics is great as well. Garden of Life has a combination of a probiotic and digestive enzyme product. That would be great to add on board. With probiotics, making sure you're picking one that has 50 billion CFU or higher. The more strains, the better. It's going to help create a healthy balance of bacteria in your GI tract. That's going to aid with digestion, help with bowel regularity, boost your immune system. Studies show higher amounts of weight loss with those supplementing with probiotics as well. It's going to help with absorbing your B12. Again, I love Garden of Life. Align has one, Culturelle, another one that is available. I'd also pause on this slide to share with you guys. I work in functional medicine quite a bit, so it's a lot of supplement and more of like holistic approach to health, and some supplements I also note that work well for those of you experiencing heartburn or GERD, any of the acid reflux symptoms, or you just feel a burning in your stomach because of all of the acid production. I have some supplements that might help you. One of them is slippery elm. Usually you can either get it as a tea, a powder that goes in a tea, or you can do a capsule version. One thing to keep in mind with slippery elm is that it's going to basically coat your stomach and protect it from excess acid production. So if you are consuming, make sure you take slippery elm 2 hours away from any other medications so that we don't affect the absorption of your medications. But slippery elm can be helpful. Another one is called Alginate. That can help with acid reflux in particular. What it is between your esophagus and your stomach, there's a sphincter, an opening and closing sphincter. And what can happen when we're having acid reflux is that we're getting backflow past the sphincter. So the Alginate supplement is an algae-based product. The algae, when you consume it after a meal time and ingest with some water, it's going to float to the top part of your stomach and help seal off that sphincter and prevent the backflow. So that's another one as well. I'll put that in the chat box too for you guys since I don't have it on the slide. And then I want to address other questions. And slippery elm. Perfect. So I have those on there. And again, for any supplements, make sure you're discussing with your physician before starting, just to make sure it's not interacting with any of your medications, and they might be able to better tailor recommendations for you on dosaging, how often. Probiotics is something that if people are taking it too often, sometimes they get GI discomfort from it. So generally with starting a probiotic, I would take every 2 to 3 days at the beginning to see how you're tolerating. So now I want to optimize our time on just questions. So if you are all set with the information that was provided today, you're welcome to log off now. But now I'm just going to answer questions. So I'm going to start with the chat or with the Q&A box, and then I'll revisit the chat box at the very end to see what I didn't cover, okay? And if you have any questions that I didn't address today, always feel free to reach out. The phone number is here, and then the email is down below. That will link you to our nutritionist here. So it won't be me talking with you, it'll be our nutritionist, and you'll discuss with her your questions. Well, let's jump into some more questions I did not answer. Okay. In the pre-op, do we have to use protein powder or shakes? Or is it okay to just eat whole foods as you described up to the liquid diet right before surgery? Yeah, so I would actually promote the food first. That's an excellent question. Promoting food first because it's going to stay in your stomach longer, promoting that feeling of fullness, versus a shake is going to empty out a lot sooner. Plus, it's also just enjoyable to eat food, right? Okay. So someone's describing that they're post-op. They love salads, veggies. They're generally vegetarian. They eat a little bit of lean meat. Their question is, eventually, will they be able to add back in raw vegetables? If not, this is difficult long term, as I do not want to forever just be on cooked vegetables. That's a very good point and a valid point. So generally, I would say those first 3 to 4 months, the raw vegetables are going to be very difficult to intake. A big reason for this is that our GI system just isn't equipped right now to early post-op to digest those foods. It takes a lot more work versus the cooked foods. It's already pre-broken down with that heat. So applying that heat helps break it down. Same if you were to juice something or blend it. You're already helping with that breakdown process, so it's less work on our body to digest it. So I would say that for at least 3 to 4 months, you're probably not going to be anything like salads. Another way that you could add vegetables is through shakes. That's an alternative. And I'm not saying that you can't ever have salad again, but I would caution that for some people, salad is something that's really difficult to add back in until probably past that 4-month time. What are your thoughts on vitamin patches? I'm so glad somebody asked this question. So vitamin patches have been very trendy, and I would dissuade against these just because we don't know how much your body is actually absorbing. And it can vary person to person. If you are going to choose vitamin patches, I would recommend having frequent follow-up with your primary care to get your lab work done to identify if there's nutritional deficiencies. But generally speaking, there's just not enough evidence yet to support that they are guaranteeing this nutrition for you. When do we start vitamins post-op? 2 weeks after. I didn't get to start the webinar until about 5 minutes ago. How can I see the full thing? So I believe we are sending out, if you signed up for this webinar, we'll be sending it out afterwards, the recorded version. We also have this available on our website. We have recordings of either me or our past nutritionist, Brittany, doing webinars. So those are also available. This will also be streamed live on Facebook. So hello to anybody on Facebook who is viewing this. I'm going to try here at the end to see if I can open Facebook and see the questions that you guys asked me on there. And I apologize if you're viewing this from Facebook and I haven't answered your question yet. And the slides will be available for the vitamin schedule. I'd also say too, you can also email the nutritionist. She should have access to our webinar slides and she can send you the slides for your convenience. Oh, and thank you for adding in the Q&A box, the slippery elm that I talked about and the alginate. Thank you. What happens if I exercise too soon? So what I recommend when it comes to exercise is starting out with that low intensity workouts first. Things like walking, stretching, are good. Avoiding anything that's going to be using a lot of your core muscles, okay? Following the guidelines are given to you during post-op because different surgeries will have different recommendations. I believe the past nutritionist, Brittany, had some videos on the TikTok base that had some videos on some exercises, upper body exercises with hand weights that you could do. So that could be an option as well for finding more exercises that are suited for you. I would recommend once you're past that 8-week mark to incorporate some more vigorous training, things that are going to get your heart rate up, because that vigorous training and weightlifting, weight-bearing exercises are what's going to boost your metabolism. And that can be its own separate webinar of its own. And I believe I have a Facebook Live video from a long time ago about stalls and about bringing back how to repair your metabolism. That would be helpful. Let's see, I'm over 3 months post-op right now. I'm skipping breakfast out altogether. Intermittent fasting, is it okay to do that? Love this question. Thank you so much. So that's a really good point. A lot of people lately have been shifting towards intermittent fasting. I work in my other job. I see this all the time. And what I would say is generally for a non-bariatric patient, people can find really great benefits with intermittent fasting in the sense of, yes, you can get weight loss from it, and you can also have better blood sugar control, improve and prevent diabetes, right? What is complicated is that for my bariatric patients, I would dissuade against this just because you guys, you have smaller stomachs, so you're able to intake less food at one time. So somebody who's intermittent fasting, who's non-bariatric, they can intake they can do 2 meals and a snack, and their meals can be 500, 600 calories at a time for them to be meeting nutritional needs and then having like a 200, 300 calorie snack. For my bariatric patients, you're not going to be able to get that caloric load in that small time frame. So I would recommend away from the intermittent fasting. I'd also say those big concentrated meals are going to be harder on your GI. So if you're somebody who's prone to dumping syndrome, feeling bloated, getting nauseous, I would really dissuade against the intermittent fasting. That was excellent. Let's see here. And I'd also say too, the intermittent fasting and calorie restricted diets are pretty similar in their results for weight loss. Really, the intermittent fasting just kind of has a bonus with some better insulin control. So I wouldn't be too worried about you not being able to intermittent fast. What is going to be your tool is your bariatric surgery. Who will advise on the medications, particular ones like antidepressants and hormone replacement therapies? So that will be Jen. Jen, our surgical liaison, will help with medications that you're currently on and identifying how you need to adjust leading up to surgery and after surgery, reintroducing them. Long term, that is something you're going to take up with your primary care. I've been having metallic taste in my mouth lately. Why is that? So that could be a sign of a nutritional deficiency. So I would go get lab work done with your primary care to identify, and that could be a sign that maybe you have an iron deficiency. It's probably one of the most popular deficiencies I see. Sometimes even just a protein deficiency can lead into this too, but that metallic taste makes me think it's maybe iron related or one of the B vitamins. Let me drink some more water as we're going, otherwise I'm going to lose my voice. Okay, I've been measuring all my food, but how do I know if I'm full or not? That is excellent, excellent, excellent question. So a lot of times your feeling of fullness is something that you're going to kind of have to relearn. I think a lot of us non-bariatric or bariatric patients don't really follow our hunger cues or have that awareness of fullness. Fullness is on a scale of 1 to 10 is how I like to look at it. 1 being you're famished, starving, 5 to 7 you're more content, 10 that's like Thanksgiving in your stuff, like a holiday meal. You've eaten too much and you're uncomfortable, you're bloated, maybe you feel nauseous, or whatnot. So it really depends. So that's something you're gonna have to check in on yourself before entering a meal. See how you're feeling. Where are you on that 1 to 10 scale, hunger fullness scale? Try to stay within that 5 to 7 range, because if we are constantly on either end of the spectrum, if we're too much on the 1 and we're famished, we're going to lead to uncontrolled food intake. If we're on the other side of the spectrum, we're going to have really unpleasant GI symptoms, right? So things to consider, that's going to be you building those skills and becoming more intuitive with your eating. And if you have a history of low food intake, your hunger cues are going to have diminished. So it's going to be something that you're going to have to rebuild over time. Okay, I'm 8 weeks post-op, gastric bypass. Moving into a new home. Is it okay if I lift heavy boxes or should I wait? That's a good question. That's kind of outside of my scope. I would say they always say when you're lifting with your legs, right? But I don't know, if you're engaging your core muscles, that might be something to reconsider, especially if you're doing this over a long period of time. For me, I know moving takes a while. So I would perhaps be hiring some help, calling up some friends to help you out during that time. Okay, somebody was saying how they cheated on their clear liquid phase. They cream of wheat, almond milk, and haven't had any stomach issues, but they're concerned. They're concerned because they're in their post-op diet part. So they cheated on post-op diet. Is this okay? As long as you're not having any stomach issues, I wouldn't be freaking out. But it's something to keep in mind that, okay, no more, like we don't want to be adding any more food until you're kind of done with that. At least 3 days, the absolute minimum for that clear liquid portion, because we want to be giving our digestive tract a break, a rest, okay, for that recovery. So as long as you're not having any major stomach issues, that's good. What can I do if I don't feel like eating anything at all? So if you have low appetite, this is going to kind of depend if you're pre or post-op diet. If you're pre-op diet, I would say that this might be coming because you've had diminished hunger cues, and having a regimented schedule might be good to establish that meal pattern, bring back regular intake, and flourish those hunger cues back. If you're post-op, if you're feeling like low appetite, this might just be, again, you've had low intake, you're on different medications post-op, your mood is altered, going through this whole experience. So you have lots of things contributing to altering your appetite. So it'll be important that even if you don't feel hungry, that you still get a baseline nutrition in. I'm scared about hair loss after surgery. How can I handle that? You're not alone in that feeling. A big thing, again, making sure you're intaking protein. Make sure, I think what's really helped for myself of just maintaining good hair growth is I like to take a collagen supplement. So I love the Bible's protein collagen, and I'll mix that in with like a protein shake. That is really helpful. Making sure you're getting good biotin and zinc in. So that's usually in your multivitamin, but if it doesn't have adequate amounts, you can get a separate supplement. And there's something else I was going to say on the hair loss. Oh, making sure you're eating good seafood intake can help as well. Those are natural sources of biotin and zinc. So are your nuts. And also, I would say too, just having good hair products as well. Some shampoos can promote some more hair loss that I've been hearing. I'm not an expert on that, so that's outside of my scope, but something to consider as well. Is there a diet plan I should follow after the post-op diet? Yeah, so we do have, I'll back up to our slide that had the sample meal plan. So the right-hand side is kind of the macro nutrition goals. These are general. Remember, nutrition is not one size fits all. Left-hand side is a sample meal plan. So some things to consider. So I'll leave this slide up for a little bit so you can take a look, screenshot if you need to. I'm going to look at the chat box and make sure I wrapped up any questions. Oh, wow, there's a lot of chitter chatter. So no dairy during pre-op. You can do vegan cheese, that's okay. Does potatoes include yams? So during pre-op, no yams, no butternut squash, no potato of any sort. Yes, you can have 100% juice during pre and post-op diet. I would just dilute it. So have 4 ounces worth and dilute with water. Probiotics. So stop taking probiotics 2 weeks before surgery. You can restart it 2 weeks after surgery. Thank you for helping each other out. Promoting the foods first over the shakes. PB powder is okay to add to a protein shake and another source of protein. Just keep in mind some of those have some added sugars in them. Like I believe the PB Fit might have some added sugars, but I'd have to revisit. A lot of these products change over time. They change their formulation. So it's really good to always be checking the nutrition labels because they always surprise you. I used to love suggesting the Orgain nutrition products because they used to all be plant-based, but now they've been sneaking in dairy into more and more of their products. So something to keep in mind that these businesses, these food companies, they reformulate every once in a while. So you need to stay up to date. Can we use any broth? Yes. The sugar-free Jello and sugar-free Powerade is red. Is that okay? Yes, you can have the colored. Somebody said, so basically 2 weeks before we need to be on a liquid diet. No. So it's just 2 days before surgery. So you shouldn't be doing a clear liquid diet for an extended period of time. I know some people like to do, oh, I want to start the clear liquid diet early. That's really not going to add much benefit. It's going to put you more at risk for malnutrition. And especially if you're traveling with poor nutritional health, and not getting these immune boosting foods during a time where COVID is prevalent, I would be very concerned. So only do the clear liquid portion for the 2 days pre-op and then 5 to 7 days post-op. Stopping the vitamin supplementation before surgery and a little bit after surgery because we want to prevent any complications during surgery. They use their own medications as well during that surgery, so we don't want any interactions. So it's just a general guideline for all patients. And then after surgery, if you don't have a lot of food intake, you're not going to tolerate your vitamins very well, and you're not going to be absorbing it very well. So that's something to keep in mind too for some of you with your iron supplements, that you may have poor toleration unless you pair it with food. So avoid taking your vitamins on an empty stomach. And that's why we usually wait 2 weeks after surgery, because hopefully you're starting that thick liquids, you have a little more sustenance in you to help with the GI tolerance of these vitamins. Thank you for helping each other in the chat box. Someone had mentioned towards somebody that yes, your diet is based off of BMI, and that liquid is only 2 days. Thank you guys. Fairlife protein is 13 grams of protein, and it shows isolate. Is it okay? Yes. Only 2 grams of total sugars, 3 grams of carb. Yes. And that's more for post-op. Oh, I had somebody else who went to Oregon State. Woohoo! Okay, insert some of these. And how will we know how many days to continue this? How long will it take our new stomachs to process towards being functioning like your stomach that you had before? So it's something that really it differs from person to person. I wish I had this strict guideline that I could tell you and give you those answers. It really depends. So that's why the post-op diet is generalized. Those are general guidelines. It's okay for a little bit outside of the guidelines, and something that you should talk about with the nutritionist to make sure we're not having any complications. But generally, I always like to say, if you have 5 days of good toleration on any stage of that post-op diet, that's your green light to move on to the next diet stage. Because the quicker we can get you to that last stage, the better, because the more variety of foods you can add in, the better nutrition and health you'll have. The 48 ounces of hydration is the bare minimum for water intake post-op for those first few days. If you're not getting that intake in repetitively for a few days, I would look into an urgent care where you can get IV liquids. I discussed vitamin supplementation, which while I'm discussing vitamin supplements, why don't I go back to that schedule so you guys can screenshot here. Okay, I think I'm answering all the questions. Let me make sure I got everything covered. Wonderful. I hope I answered all those questions for you. I'm going to backtrack to the last slide so that you have contact information. Again, I'm Prabha Honrath. I'm a registered dietitian. The contact info below is for a different nutritionist, but she is equipped and ready to help you guys answer questions. All right. I really enjoyed my time presenting with you guys. Thank you for hanging tight with some of our audio difficulties at the beginning, and for having a good time, giving me good questions, and I really enjoyed this. I hope you all take care and have a happy Friday.